and understanding as we do that needle fear and fear in general and pain are really big drivers of mental health issues. Are there any suggestions or the things that we can do differently? You know, we're always big at nView on screening and screening people and trying to get ahead of some of these issues. What are some suggestions you might have?
You know, it's a great question because the work of a guy named Chris France, the one I mentioned, who was looking at whether people come back to give blood a second time, what he found was the most helpful for people that faint with needles is screening, is asking, how afraid are you of having blood drawn out of your arm?
Hmm.
People were very loath to talk about needle fear or mention needles because they were afraid it might trigger it in the patients who did have fainting or fear of needles. It turns out that what they needed was just someone to ask, are you afraid of having blood come out of your arm? Because then once that initial screening was done, it enabled the patient to be able to say what worked for them, what their problems were. It enables the caregiver to say, oh, we can address that. Here's how we'll deal with this. So I think like with many things, until you ask, you can't address the problem.